popping, clicking, cracking. There are lots of names for it, lots of sounds that come out of our joints. There's a whole video on what's clicking, right, to see how you can discriminate between different things. Lots of different things go pop, go bump in the night. We're going to look today in this video at the hips, very common area to get popping and cracking going on. It can happen in different areas, so I'm going to do different videos on the different areas these pops and snaps occur. In this one, we're going to look at snapping or popping in the front of the hip, so more in that groin area. And this typically tends to happen when you're bending the knee up or in extensions to the front. And quite often it's when you're lowering down from that extension and there's that nasty moment where you kind of go, oh, and there's a little clunk as you come down. So let's have a look at what is going on and what we can do to remedy the situation. We're going to be looking particularly in this instance at a muscle called the psoas muscle. It's a funny one because it's spelt with a P. If you don't know what that muscle is, go and check out the video on Meet Your Hip Joint and you can see that muscle and get familiar with it because it's one that's really important to us as dancers. It connects our lower back, our lower spine to the leg, and it's very important when we're in a lot of our extension positions, and it's typically the one that's causing the popping and cracking at the front of the hip. When you see the anatomy of that muscle, it actually runs just over, I can show you on our little friend here, it runs just over the edge of the pelvic bone here, and sometimes there's a little bump on the pelvic bone here that kind of keeps the tendon of that muscle in place, and sometimes it can be bumping over it. In other instances, it can actually rub on the front of your hip joint. So the hip joint is under there too, and it has a little capsule around it, and sometimes as the psoas is passing over that, it can catch there. You will also see this muscle referred to as the iliopsoas because there's another muscle called iliacus. Go on your little detective journey of the videos to find that muscle, but it essentially sits on the inside of the pelvis here. It kind of lines the inside of your pelvis. And as the psoas comes down from your spine, it joins and blends with it, and they both attach to this little bump on the inside at the top of your leg. So the two coming together, where they start to join, sometimes that's another area where we can get a little catch around that. To discriminate those things, you'd really have a healthcare provider go in and do a clinical assessment to see and to sort of pull out which structures are particularly at play. These videos are designed for you and what you can do and what you can discover on your own little detective journey, and then show you things to do to help remedy that. So what we're going to do is I'm going to pop Anterior into a lying down position. So if you want to have your head up that way, and we're going to look at the sort of times and positions where that popping happens, and then look at what it's doing in terms of stability for the body as well. So what we'll do first of all, if you bend this knee up so that your leg's flat on the couch, what we want to do is stabilize the pelvis. So by bending this knee up, we're taking any tension of the hip flexors out of the equation. And then what we're going to do with this one is actually develop it in and up to the ceiling. Okay, so we're going up, and then you're going to slowly lower that down to the table. And do we get any popping? No, we're good. That one's quite quiet, and it doesn't look like it's making any gear changes. Sometimes we get to about this spot, and there's sort of a clunk, clunk going on. Let's try that with the other leg. So if you switch over, and then just développé this one straight up. Good, and then slowly lower that down. No noises, but it kind of felt to me a little bit more hesitant. Did it feel it to you? So it just kind of felt like, So it's not they don't always click all the time, right? But sometimes you get that, what we call the anticipation of a click. That's almost the same thing because your body knows, it's your body telling you, ooh, I'm not sure about this. Okay, so now we're going to have a look. If you straighten that leg down, I want to have a look now at what I call the launch code. So every time we pick our feet off the floor, be it in a développé or even just walking or running across space, we have this kind of paddling-like motion. And what we want is for our pelvis to be nice and stable as we're doing that. And to produce that movement, when we've done it for years and years and years, not just in our dance careers, but in our regular life as well, we build up a kind of launch sequence of which muscles fire in what order. And sometimes that launch code is leading us down a path where that click is going to be more likely or where instability is more likely. In dance, we tend not to be very good at looking at the micro detail. We tend to be all about, where's my leg up in the air? You know, I want to look at the end product rather than how did that foot get off the floor. I'm really interested in the really subtle stuff. Remember, be a detective. Go and look at the subtle clues, because if you've set up that développé, kick, whatever it might be, with a launch code that's going to affect or negatively affect that hip joint, as soon as that foot's left the floor, you're on the train. You can't get off it. So we want to make sure that we set things up correctly at the beginning, therefore we're not kind of sabotaging ourselves further down the track. So let's have a little look. I'm going to come and look lengthways now at the body, and I'm looking up the line of the leg. And what I'm interested in here is what's going on around the hip and lower back area. So what I'm going to ask you to do, let's do this leg first. And you're going to keeping the leg on the table. And you can do this on the floor, you know, you can try this on yourself. But you need to listen to your body as you're doing it. And you're just going to do a very slow little développé, or retiré really. Yep, coming up really slowly. Just come back down again. Let's take it way more slowly, and I want to be really mindful about what's going on up at the pelvis. So slowly bend that up. Yep, okay. So there's actually quite a lot of effort going on there just to do a little retiré, and we'll talk about that in a moment. But let's have a look compared to this side. Okay, so this side, we've got quite a difference between the two sides. I don't know whether you can feel that, but there's different strategies going on here. Our bodies are not symmetrical. You'll hear me say this over and over again. They're not symmetrical. They operate slightly differently on different sides, and that's okay, but we need to be aware of it, okay? We need to know what we're dealing with. So what's happening on this side, if you just do this one again, just set that up. So immediately as she's gone up, she's actually kind of tucked into this pelvis. I don't know whether you can feel that. And we're having a little bit of a rock and roll over this way. And what's also happening as she comes a bit further up, just come a bit further up, is we're recruiting a lot of the muscle up in the waist area, particularly what's called the quadratus lumborum muscle at the back, to get that leg up. Huge amount of effort that you don't need, okay? I'm all about efficiency. How little effort do we need to do to get the job done? Because a lot of that is going to be creating some compression in the hip joint, and that's not going to make our extensions particularly easy at the other end. Now if you do the one on the other leg really slowly, so with this one what I'm seeing is that this leg feels actually relatively organized, quite stable, but we're still getting that rock going, and it's actually happening a little bit more this side, but we're not recruiting all this extra effort here. So this leg's taking care of itself, but it's the opposite side of the pelvis that needs to stabilize. It's your standing leg that needs to stabilize for this one to work. So it's actually still telling us that the issue is more on this side. So it's creating a bit of compression on its own side, and it's not stabilizing the other side very well for you. That's going to predispose that clicking, because we've got everything shortening up and compressing in this area. Okay, so how do we unravel that? So first of all, we want to, my senses, because I've been doing this a long time and I can detect these things, my sense is the psoas muscle on this side is a little tight. When the muscle is tight, it's weak, okay? So it's not giving you, it's not available for you to use, and therefore you're having to borrow from a lot of other muscles to get the job done. The way we can assess that, if you just bend this knee up, so your foot's flat on the table, And the psoas muscle, if you look at the anatomy of it, it's very deep. It's on the inside of your spine, okay? When you see pictures of muscles in the abstract, you also forget there's lots of other stuff there that's not in the picture. Between the abdominal muscles at the top here and that psoas muscle, you've got all your internal organs, okay? So there's lots in there. A lot of people go diving into psoas and sticking their fingers into it. Not advisable if you don't know your anatomy. If you leave that to a professional healthcare provider if they feel it's necessary. It's not necessary to dive in there to loosen this muscle up. I'm going to show you a really quick and easy way that you can open up that psoas muscle. But I'm just going to do a little assessment just to see what the tension is. So I'm just going to put a listening hand over the abdominal area here. The psoas muscle is deep underneath this. I've been doing this a lot of years, so I don't need to dig all the way down. I can feel things through other layers. So what I'm going to do is just ask you to bring your knee up towards your chest. So we're activating the psoas, and yeah, I can feel it's kind of popped up, stood to attention as we did that. If we just swap knees and just do the same on this side, different. Yeah, can you feel that? So that just feels like a nice neutral psoas muscle. So this is the one that we want to release up. So the way we're going to do this is called a soft tissue release. If you look at the stretching series of videos, this would fall into the category of a dynamic stretch, because we're actually going to activate the muscle as we stretch it, and that gives a more powerful stretch to open up the tissues. I'm not a big fan with this psoas muscle of just doing those passive static stretches into it, because it's quite a reactive muscle, and if you load it up, it often does the opposite and tightens up as a result. This way, we release it, but we allow it to still have its own tone. So we're not completely switching it off, because it's a stabilizing muscle. We want it to be active. We just don't want it to be super tight. Okay, so this is really easy. You can do this yourself. It's highly recommended that you do. We're going to bend both knees up for this one. Just put them flat on the table here. And what we're going to do is literally what we were doing before. You're going to développé this leg up to the ceiling, and you're going to very, very slowly lower it down to the table. Really slow, really slow, really slow. So we're really asking that muscle to work. The lower it gets, the harder it has to work. And then before you get right down to the table, so getting it all the way down there, well done. Before you touch, you're going to bend it back in, cycle it back up to the ceiling without putting it down. So we're keeping it active through this cycle, and slowly lower it down. Try as you're doing it to feel really long in that leg. Yeah, there you go. So we're not getting into that habit of compressing in. Remember, as dancers, our muscles have to be long and strong, right? Not short and strong. Beautiful. And then one more round. So we're going to do 3 rounds of this. It's the best number to do, really slow. I know it's getting tired. Okay, slowly down. This is easy, not particularly strenuous, right? Not painful. Nope. Okay, great. And lower down. So it shouldn't be effortful. You should feel it working, and then just bring that knee in, let it relax out a little bit. And that's 3 rounds of a soft tissue release or an active release for that psoas muscle. So let's do our little before and after. If you straighten the legs back down again, and let's see what's happening now with this one. We're going to do that little straight retire again and see what's going on. So a nice slow retire, much more stable, yeah? And not so much extra effort going on up the top there. Wonderful, and down again. Now let's look at this side and see if it's stabilized out your pelvis a little bit more. Yep, still a little subtle rock, but not quite as much as we had going on before. And that was just with 3 repetitions. Imagine if you were doing that a couple of times a day, 2 or 3 times a day, every day, then you're opening up that psoas muscle so that it's available for use, and we're not having to use all these extra muscles. Okay. Now, another thing we want to look at to get you, so when you've been doing that sort of sequence of muscle firing for a long, long time, we're all in our habits, right? it becomes the default, right? The brain goes, okay, when I lift my left leg off the floor, I'm going to use all of this stuff, okay? And it's something we have to actively retrain. We can't just go, don't do that, right? We actually have to actively retrain it. And again, this is the subtle stuff, little motions. How do we get that foot off the floor without involving all that extra stuff? So what I was kind of getting the impression there as you were doing it really on both legs is that your image, so a lot of this is about the image you have in your mind about how this movement is happening. It felt a little bit to me like I'm moving my knee towards my chest. So it was very focused on the muscles on the front of the thigh, like the quad and the TFL muscle. What we want to do is change that picture. And I want you to focus this time on the back of the leg. So rather than bringing your knee to your chest, you're bringing your heel to your sitting bone. Almost like the table's not there and you're paddling the leg behind you like you're in water. What we also want to do, because we had that little bit of compression with the hip, if you are lifting your leg off the floor by first scrunching your hip joint together, it's not healthy for the hip joint and it's actually going to restrict flexibility higher up. So what we want to get into the idea of is I'm going to do a lovely traction here. So I'm just pulling on her leg here and opening up that hip. Are you feeling that nice sense of opening? And I want you to imagine that you've got a little airbag in your hip. So where that round thigh bone meets the hip socket, imagine you've got a little pocket of air there. And when you do the développé this time, you're not allowed to pop your airbag, right? You've got to keep that nicely floated. So literally nothing's going to happen up here. This is going to stay lovely and open. You're going to keep that sensation that I've given you there by pulling that leg out. You're going to imagine you press down through the table and draw your heel up the back to the sitting bone. So we're going to use the hamstrings to bend the knee. Hamstrings are the muscles that bend the knee, not the quads, right? The quads bend the hip, but to start the movement, all we want is the knee bend. So using that imagery, lengthen first, down through the table, and then beautiful, yes, completely stable here. And that hamstring's beautifully fired up, wonderful, go back down. That normally takes people like 4 or 5 goes to get that, so you've got that locked in really well. So keeping this one nice and stable too, lovely and long, heel down, bending up, yeah. And what's a good thing to do is if you actually put your hand on your quad, you want to make sure that's not kicking in. We don't need the quad just to initiate the movement. It will be involved as the leg comes higher up. But to start off, all you're going to use is that hamstring and nothing happens up here. So heel towards, that's it. There's a little bit of quad going on there. Can you feel it? So what you need to do is, this is reprogramming, okay? It doesn't happen quickly. I'm always suspicious of quick fixes. Everybody wants a quick fix, but I'm always suspicious. It's like a crash diet. The weight all comes on the following week, right? So this needs to go, nope, you're not allowed to play. You're not in the mix. You're going to put your feet up, have a rest. Can you get that leg into that retire position without having that quad fire up? So just relax. There you go. Yeah. Beautiful, so that's nice and relaxed. It'll come into play as it comes up a little higher, but if you set up your développé using the back of the leg, we haven't got that hip compression going on, therefore it won't be there all the way up. So the moment that foot leaves the floor, we've got to be mindful of it. Does that make sense? Does that feel a little easier? Do you want to just try that on the other leg as well so we equal you up? So can you feel that like, I want to pull my leg this way? And I'm going to say, no, you're going to pull your leg this way. So feel that pulling up? No, no, no. So lengthen. It's complete. It's like patting your head and rubbing your stomach, right? It's the reverse of what you want to do. Lengthen the leg down through the table. Better. There you go. The quad's off. So it just takes a little bit of concentration to get that, but that's something to play with. Honestly, it will make a world of difference to your hips. If you're getting hip pain, hip compression, hip clicking, that can be something that can radically alter that. Okay, so let's just for the last few minutes bring you into a standing position. So sit yourself up, just let the blood come back to your head for a moment. Been down there a while working out. And what we're going to do is, how do we translate that into movement? Because that's wonderful. Oh, I can do it lying on the floor. Brilliant. How do I get that to work when I'm actually in space? How do I initiate that développé when I'm in space? So there we were working in parallel. You can also do it in turnout on the floor or on the table as well, because it's a slightly different strategy, but the same principles apply. We want to use the backs of the legs wherever possible. Those quad or the middle quad muscle crosses your hip joint, it will compress it. We don't want that congestion around the hips when we want them to be loose, right? Okay, so if you bring yourself to standing, and I think we'll do this face onto the camera. So now just try and recreate what just happened, and just in parallel, bring yourself up into a little développé and really feel the back of the leg working. Sorry, just a retiré is good. Yeah, good. And go back down again. So I'm looking at, how do you pick your feet off the floor? How often do we stop and look at how we pick our feet off the floor? Okay, let's try it with the other one. Okay, good. So come back down again. So what you want to be mindful of as well is, it feels like, it's because you're concentrating on the feet and the lower leg, it feels like you're pushing down into the here. So we want to recreate that idea that we're lifting and floating on those hips. So as the leg bends, it doesn't alter anything above, okay? So lifting and floating. So that was a little quaddy, okay? Back of the leg. That's it, yes. Do you feel the difference? Yeah, it's very subtle and come down, but we haven't got all that kind of gripping. Just do it the first way again, like pick your knee up. Yeah, and you feel all that gripping, yeah. Okay, so let's try it with the other one. Okay, a little bit quaddy, that one, sorry, pushing you over. Okay, back of the leg, good, 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 there you go. Different? Yeah. Yeah, so subtle thing, but it can make a world of difference. Now let's see if we can do that in turnout. Okay, let's bring you in a turned out position. So the same thing, you want to be always focused on the backs of the legs, not the front of the leg. I'm much more interested in the line of a leg, what's happening underneath. It's actually much more supportive, and remember, if we're cranking our legs in the air with the quad, we're creating compression of the hip. So let's do your right leg. So when we're in turnout, okay, so we've already gone knee, yeah? So it's more difficult in turnout, but we want to really feel like you're wrapping, wrap the back of the leg, and don't lift the knee, lift the foot. Foot. That's better, and come back down. So we just really want to do that initial. Let's do this one. Yeah, fighting me. There we go, yeah. And you feel how you're more unstable because her balance is oriented around that old program. I'm basically pulling the rug out from under your feet and going, no, you can't do that. I'm taking away your favorite toy. So we're going to need to rely on the turnout muscles at the back a lot more. Go and check out the video on turnout to see how we really refine that up. But that's just a little demonstration of how we want to go from table to standing, or floor to standing if you're working on the floor, and how to reorganize the hips for getting our legs in the air so that we're not crunching, compressing, and leading ourselves down the garden path that will end up with clicking, crunching. If clicking is happening and it's not painful, it's kind of a sign that something needs addressing. If it's painful clicking, you really need to go and seek medical advice, go into a healthcare professional, because if there's pain, then there's something getting inflamed and it's in a more acute state. And with all these things, again, you want to jump on things early so that they don't become more dramatic further down the line. So take care of the hips. If they're clicking, if they're noisy, always ask the question, why?